Today's impactful guest is Gina S. Lovasi, PhD, MPH, who is the Dana and David Dornsife Dean and Professor of Epidemiology at the Dornsife School of Public Health at Drexel University. Dr. Gina S. Lovasi, I am so thrilled to have you on the podcast today. When I was thinking about designing season 1, you were top of mind. I admire you so much. You're such a heart-centered leader. And what I particularly admire about you is your passion for curiosity, your true love of learning. And so it's so natural to me that you are an academic and now the Dean of the School of Public Health, the Dornsife School of Public Health at Drexel. So thank you for being with me today. How are you?
Well, thank you. It's a pleasure. I'm doing well. I really appreciate the time together and the chance to reflect on where I've been and where I'm going.
Perfect. So that's a great segue to our first question. So Dr. Gina, what would you say your moment of impact is?
So it's interesting. I was thinking back to what I'm proud of from different moments in my career. There have been some small projects where I really answered a question, and that felt great. There have been some projects where I figured out along the way a new question that I should have asked, and I love that sense of discovery.
Mm-hmm.
And probably the biggest points of pride are times where I made it possible for somebody else to come together with me or with a partner to answer questions that none of us could have tackled alone.
Yeah, I love that. Really inviting people into embracing their own curiosity, right? And
Yeah.
really thinking about how important the structure of the inquiry is.
Yeah. And I think in that spirit, I have a project that I've just wrapped up that going back to report on what all we had accomplished in this project on the retail environment and cardiovascular disease, there were questions that we came up with at the beginning, and then there were new opportunities that came up along the way. And maybe the thing I was most excited about to report on was that we had more than 160 people who got access to data or came together with us, worked with us on papers, helped us disseminate the work. We had formed an advisory committee by the end to try to help close the gap between writing a scientific paper and making it useful to audiences that can actually make a difference in the world. And so that feels like there's more of an impact possible by not just having, the amount that I can take on, but what I can make possible for a bigger network.
Yeah, I love that. I think one of the beautiful aspects of the field of public health is it's inherently multidisciplinary, right? I
Yeah.
know thinking back to your original training when you were a Robert Woods Johnson Fellow coming out of your PhD, I think, you can correct me, but you were in a program that was looking at population science, and there were elements of social sciences, economics, medicine, public health. And so I think that having disciplines where expertise from all these other fields comes together is so important.
I totally agree. It's definitely shaped my thinking from being, in training for a PhD, you really get trained in how to follow disciplinary models for identifying and answering questions and doing it well, doing it collaboratively, doing it carefully. When I came into the Robert Johnson Health and Society Scholars Program, I then was in the room with an ethicist, and we couldn't talk the same language at all. And I had my office next door to a social network sociologist, and we talked about distance and space, and we meant totally different things, but there were points of contact. And so we figured out this translation that opened up new questions for me and new ability to read about what other people are doing that actually I think brings life and curiosity to my work. I think several times I have felt like I was at risk of getting bored, but having these new possibilities of directions to pursue, it keeps all the work that I'm doing not necessarily easy, but keeps it feeling fresh and relevant and exciting, and leans into that curiosity of, there's so much that I don't know yet. How can I keep creating that discovery?
And I love how you're really focused in your own work and work that you're touching through other people on inviting real world applications. So just a few minutes ago, you were talking about this project that just wrapped. I have a hearing disability, so I missed part of the title, but you said it was a retail environment and there were like 160 people involved in that, and it has a real world application. Can you talk a little bit about the real world applications of that work and a little bit about what it was about?
Sure. So it's retail environment and cardiovascular disease. And we had funding from the National Institutes of Health, National Institute for Aging. And the initial work was to address a couple of things, right? So the early questions. Does creating new healthy food access, like new supermarkets, prevent cardiovascular disease, support healthy aging? Does losing access to medical facilities, pharmacies, hospitals, impede the ability to live independently? Does more physical activity opportunity, parks, gyms, walkable destinations, does that play into healthy aging, independent aging, and preventing cardiovascular disease? And so the goal of the overall project was to say, we've been doing work to get credibility for the idea that something about where we live, not just the medicines we take, but our surroundings, almost certainly has relevance to how healthy we are as we age. But can we play out things we might try to do? So if we have initiatives that would create new supermarkets, is that going to work? Is that going to work for everybody? And to answer those questions, my initial, prior to this project, I had looked at, can we identify natural experiments, places where some specific change happened and was evaluated? And I got frustrated with that work because sometimes the hoped for benefits didn't come. You would have a supermarket and it wasn't clear that behaviors were changing in the way you anticipated. But we could make sort of special pleading for how that fit without having to change our original hypothesis. Mm-hmm. Well, it wasn't affordable, it wasn't the right kind of store, it wasn't done in the right way. So I thought that what I really wanted was to have so much data that if we had those explanations for only under these circumstances would we get the benefits, we could actually explore it. Mm-hmm. So with that, we went and got data on retail throughout the US for a 25-year period. It's now been extended to closer to 30 years. And then linked that to thousands of observations of people's health over time, where we have research quality measures of cardiovascular risk and cardiovascular outcomes. In terms of what the real world applications are, I kind of come back to this progression of, could we answer those questions? Yes. We saw more promising results for access to physical activity opportunities being associated with preventing cardiovascular disease and reducing disparities in cardiovascular disease. We had less support for some of the food environment changes, like new supermarkets having a preventive role. But more important, perhaps, than answering those questions was that we created this data that brought people together across disciplines and across institutions, and that sparked new questions. So new questions came up about some of the ways that environments were changing and how people understood it. And if people understood new amenities, new positive things in their environment, like supermarkets and physical activity opportunities, as unequivocally beneficial or if they had reason to worry about them. And so what we started to hear in conversations that we had internally at Dornsife School of Public Health and in presenting the work was that neighborhood change that seems beneficial for health can also come along with concerns about gentrification and affordability and the ability to stay. And so I think as important as any of the answers to the questions that we started with was opening new questions. You know, when these retail changes are happening, under what circumstances are they seen as beneficial? Under what circumstances are they leading to harms? And so now we have a more recent paper where we asked thousands of individuals, what are you thinking about with the intensity and the type of change in your neighborhood the last few years? And does that lead to feeling like you might be pushed out? Does it lead to tension with your neighbors? So trying to get to the idea of, you know, if we're doing things that we think are health beneficial, could we be accidentally leading to harms that relate to stressors, that relate to not having a sense of security in housing? So that was kind of the second phase. So the project had a 5-year initial funding period and then a renewal phase where we had a chance to dive more into that. And I think what that connects to, just going way back to learning how to talk to an ethicist and a sociologist, is that my training was, you know, exposures and outcomes. So I'm an epidemiologist, so we measure things in the environment carefully. We look at causation. We try to figure out whether this could have caused that. And what I started to pay attention to was it's much more complex. I started reading more qualitative work. What we should do is a different kind of question from which change will lead to more cardiovascular improvements. And so it's really, even from that phase of the work where we're looking at perceptions of how neighborhoods have changed, I've thought a lot more recently about how the process of a change itself could be respectful to people and beneficial because of the process, even separate from what it is that gets put into place. So a new supermarket might be beneficial when it's part of a comprehensive community development effort, when it creates jobs, when it's seen as part of the community, and it could be harmful. The same physical supermarket if it's implemented in a different way.
Yeah, I love that. I think that's a really great way of helping people that are not as familiar with public health understand the types of inquiries that you do. And I love how the questions led to new questions, right? And it's really like a broader conversation where we're trying to understand what are the influences of factors that we're not asking about. When you mentioned affordability, gentrification, access, is it seen as integral to the community? Or is there like a displacement happening with mom and pops when this new grocery store comes in or something like that? So I love how you're like holding this space to really get at the essence of what is the answer that's going to move the needle, right? And it's not just the answer that fits the hypothesis, it's the answer that fits the reality on the ground with the people most affected. So that's thank you for sharing that. Because that's a really rich example.
Oh, thank you.
Yeah. So let's talk a little bit about causation and correlation. So you mentioned that your original fun, right? Woo! Your your original training is as an epidemiologist, and you kind of give us a thumbnail of what that is. Variables and outcomes, questions and outcomes. And so I've heard you talk about the importance of, let me just look at my notes, getting evidence-based design correct. Can you talk to us a little bit about this? And then what happens when we as a society maybe mistake correlation with causation?
Yeah, so I think the origin of the field of epidemiology is really trying to solve problems that relate to human health, not at a one-by-one level, but for entire groups of people, for entire populations. And for a long time, we didn't know how to extend life expectancy. We had medicine that was based on kind of received wisdom, but didn't always help people and sometimes caused harm. So at the most basic level, it is a life and death matter to have good evidence that allows you to make decisions, whether that's at a societal level or in the clinical setting, where you're causing more benefits than harms. I think in some of the work that I study, like aspects of retail change and neighborhood change, pedestrian safety, the changes we might make to our neighborhood environment are expensive. So there's also an issue of we might oversell something that we want to get done. I think if you're a true believer that what we need in food deserts are more supermarkets, you might make promises that are totally unrealistic. Say that, if we could get some supermarkets, then we would inevitably get these benefits, not pay attention to the how of that change, and you'd have wasted money and you'd erode trust, because now you've overpromised something and it starts to seem like any recommendation that is claimed to be evidence-based is suspect. So if we don't have a careful approach to what the observations we've made before tell us about where we're going and how we keep checking back and making sure that if we're going the wrong direction, we can course correct and we can get back to using all of the knowledge we have and the resources we have to benefit health, that we could be really way off course, wasteful, and harmful. And so I think that's some of what worries me if we're having conversations that rely, even in this era of artificial intelligence, generative AI, and some of the data science initiative that seems to really just emphasize lots of data, there's a risk that we become too inclined to confirm what we initially thought and not to really look critically at patterns in the data and say, well, okay, you see this correlation, it could be confirming what I originally thought, or it could be coming up from something else. And to just be concrete, one of the projects that I did quite a while ago, but I continue to think about, we looked at trees and asthma. And in an unfunded kind of quick analysis, we looked at whether the neighborhoods that had more trees in New York City had fewer kids coming into the school system with asthma. This was at a time when the city was starting a process of planting 1 million trees, and we saw a quick result that the neighborhoods with more trees had less asthma. So it looked like maybe that fits with the story of having more trees cleans the air, lungs of the city, and things are all great. So if you just took that at face value, promised that planting lots of trees in New York City was going to clean the air, prevent asthma, save healthcare dollars, keep kids in school, you could probably convince people that that sounds plausible. And based on the work that we did subsequently, you'd be wrong.
Yeah.
And you wouldn't get those results. You wouldn't get the results for a number of reasons, and I've worked in disciplinary teams that include landscape architects and others to really understand some of the pluses and minuses of planting a lot of trees near traffic sources. To put it simply, trees both are a surface onto which some of the particles in the air, some of the things that we don't want to breathe in, can settle, but they also slow the wind from dispersing those farther away from where we're breathing, and they produce pollen, which of course has to do with allergies, and allergies have a lot to do with asthma. So what we ended up finding when we did a more careful funded study was that living near more trees early in life may not be beneficial for asthma. It may be harmful for pollen allergy, and that may be particular to an urban setting where you have so much of a production of these particles that we don't want to breathe in. So if you want to get benefits from planting trees, my new understanding after these different projects have gone forward is that you don't want to rely on asthma as the way you're doing it. You may want to rely on shade and an environment that gets people to spend more time outdoors and be more physically active. That might benefit children. You may want to rely on more psychological benefits, that there's evidence around views of green spaces and interacting with greening spaces, actual stewardship of vegetation probably has benefits that just a lot of surface area of trees is not going to get you there. So if we take something to confirm what we originally thought and we don't question it, then we might set totally unattainable expectations and take the wrong actions, spending, money and time hoping to get health benefits and not see them come through.
That's such a powerful example, because I thought you were going to lead with like the intuitive response, yes, more trees, and then the data revealed it's not that simple, and the experimental design or the context of the inquiry is so critical in terms of how you're framing it and what facts and truth you're putting on the table to elucidate the policy choices. Because as you say, at the end of the day, we have a finite amount of resources that we can direct behind policies. So we have to make sure as a society that we are funding the policies that are really going to move the needle on the thing that we care about. And if we have this surface level finding, we're potentially directing money in the wrong way. So,
and we might be using something that sounds nice, like planting trees, to distract from the work that we really need to do.
right.
I kind of pointed to the sources of pollution in the urban environment as, something to pay attention to, because an alternative to planting lots of trees could be changing over the bus and taxi fleets that are producing that pollution in the first place. And subsequent work that I've done suggests that the places where in New York City that work has been done, and where residential buildings are moving to cleaner fuel sources, that matters measurably.
Yeah. So in these studies that you do, I imagine the citation of resources and sources of findings is really important and really robust, pages and pages and pages. And over the weekend, I was reading this article about AI. And you are a dean in a university, so I kind of want to go there for a minute. And I wanted to get your reaction to this, because it was some research that was done by the U.S. Artificial Intelligence Institute. And they were talking about how the brain is plastic, and the brain wiring is changeable. And they were talking about people whose job today is as an augmented AI, a human that's constantly working with AI agents all day long. And they said there's some things that they've seen on like functional MRIs where they're looking at the hemispheres of the brain and the wiring dynamically while it's happening in response to stimulus. And they're seeing that these people that work a lot with AI, they're getting better at handling processing large data sets. They're getting better at pattern recognition. But, spoiler, They're getting worse at critical thinking, creative thinking, and emotional intelligence. And something that you talked about a couple of clicks ago in this very conversation is confirmation bias. And they were talking about how dangerous the confirmation bias is when you're backed up by AI, because the AI has a confirmation bias built in. It also has it's also pulling off of biased LLMs, right? The data set is biased. There's bias built in, and then your own human confirmation bias is getting activated by the AI. So basically, they were saying that we've lost the ability as humans, when we spend huge amount of time, to really exercise our critical thinking, our creative thinking. In fact, there's less electrical activity in those brain centers, and we're losing our emotional intelligence and our ability to challenge or come up with divergent thinking is not happening because we've conceded all this power to the agent. So that was quite a mouthful, but I'm really interested in exploring this with you because you sit at a premier institution focused on educating practitioners to go out and help protect human health at population scale. And so over to you.
Yeah. So,
Over to you.
you know,
with that.
what comes to mind is we've just gone through a strategic planning process as a school, and AI is a big part of where Drexel University is headed in making sure that we are future ready. But in our school's vision, we talk about being a trusted leader in public health. And I think having that goal centered, it highlights a couple of the things that we should and shouldn't do with generative AI and with machine learning and the other ways of incorporating the new technology directions that we have at our fingertips and increasingly accessible. So first of all, being a trusted leader means that we lead, right? That we don't just hang on to where we've been. So I think we need openness to figure out, like, what is it that we may not have been teaching, experiences we may not have been offering, that we need to give now because of where the workforce is headed, because of what our graduates are going to need to do. But the trusted part is really important, because if we train people to just feed their bosses, members of the public, what they hope to hear, then we're going to be in the situation where it looks good for a minute and then the results don't come through. And we'll have lost ground and lost trust, plus potentially lost our ability to ask and answer important questions. So in that space, I think the two guardrails that I want to always keep in mind with AI is that we, first of all, don't use AI for fraud, just to put it bluntly.
Right.
So using AI and claiming that something was done independently, claiming authorship without attribution to the tools that we've used, that is a way to erode trust pretty quickly. Also, we want to make sure that we are not turning off our critical skills, that if we're generating something with acknowledged use or appropriate use of artificial intelligence or machine learning, that we are continuing to be thoughtfully engaged in review of what gets produced so that we can avoid things that are egregious and trust eroding. And I'm thinking about instances where reports have been generated that have fabricated references, right? You can't verify the sources because they don't exist, because they're just a mishmash of names and words that look kind of like a title, that look kind of like a scientific article, but there's not in existence. So having that human review is helpful for avoiding missteps. But maybe the most important to some of the findings that you're pointing to is sometimes what we're doing is for the purpose of learning. Sometimes the point is to dive in and allow ourselves to be open to new insights, to develop the muscles around being critical about what we're getting. And if we're using artificial intelligence to mask that we haven't learned, then we might be missing the point entirely. And I think this analogy that I came across, I really like. You wouldn't hire somebody to be your personal trainer and just have them go lift weights by themselves. Right? Like, you wouldn't hire a university to help you develop the cognitive skills that you need to be successful in your field and then just hand all that off. It wouldn't make sense. So I think for us as a field of higher education, we need to figure out what the competencies are that our graduates should have as their trusted members of the workforce, how to set them up for that, and also, what the guardrails are that we need to make sure that learning's happened. Because we can't be just a credential factory.
Right.
The only way that I think we build trust with the broader society and across our field is by being an actual place of transformative learning.
That's a really prudent and precise answer. And I love that Drexel is embracing training its students to go out in the world and be able to use AI for all its many benefits, which are many, and to just also, in parallel, be developing their critical thinking skills and thinking about the importance of double checking the attribution and the source trail that the AI model is using when it's augmenting their work. So
one of the places where this has been coming up in my work is that I'm producing an online course for our honors students for next term.
Okay.
On how to save the world. And so when you start talking to folks at Drexel about how to save the world, we end up in conversations about both saving the world from AI, unethical use of AI, disengagement due to over-reliance of AI, and AI as tools in the saving. I think one of the conversations that I'm really curious to learn more from is we had an expert who was going to talk to us about how to save the world from a robot uprising. And I'm pretty sure from his slides, he's going to talk about how to save the world via a robot uprising. So figuring out like what time horizon are we looking at? What are we trying to do? And how does AI fit into that? Kind of tying back to where I was in thinking about neighborhood change, where I went from very early on, like, what should we build? Supermarkets, hospitals, or gyms? To how should we build? Who needs to be involved? What concerns do we need to keep in view even when we're trying to do something that's health beneficial? I would bring that same lens to incorporation of artificial intelligence tools like generative AI. What are we trying to do, and what do we need to keep in view? I know one of the cautions that's come forward from the community at Dornsife School of Public Health is we have the impression that some of these tools are free because we may not pay on a per click or per use basis. And Drexel is moving towards an enterprise license that will address some of the concerns, by having a university level access to Copilot and ChatGPT through OpenAI. We'll have a space where our intellectual property isn't feeding the models, but we can use the models in our work. But often if you're not paying, you're the product. If you're not paying for the use of these, you have to think about like, why is it available to you? And is it because you're providing the training data that will be monetized in the future? And the other costs that come along is not only your own time and ownership of the things that you produce, but the energy costs, the footprint of the infrastructure needed to allow us to do some important work, like trying to figure out where we can have a more cohesive understanding of what we should do to make cities healthy. I think that's worthy use of AI. But a lot of AI use is to create poems and jokes, and
Right.
some of it is trivia, right? And being used as though it has no cost. And I think we should be in conversation with each other about that.
Yeah, that's such a good point. I mean, obviously, whether you're for it or not, it's here. And so then the question is, with every new technology, how do we find the best use cases that are really moving forward human progress on the things that we collectively as a global society care about? And how are we preventing some of the harms, such as, bias, lack of privacy, leakage of intellectual property, leakage of personal data, because we haven't quite yet agreed on global governance or global standards for those things. And I heard a fascinating piece yesterday where they were talking about actually GDP growth in the US would be flat right now, except for the investment in data centers. So it's the water, it's the electricity, it's the build out additionally. So yeah, I think what we're both concluding is we're all for the responsible use of AI, which is going to help us solve some intractable problems, but it's not a one size fit all to solve every prompt or every query.
Yeah, agreed. And I just wanted to feed back to something you had raised about bias,
Yeah.
that is related to the human language that large language models feed on. I think as we continue to have experience where people are using, especially free tools, to generate text, I think any algorithmic tool is going to be very sensitive to what you're training it for. Like, what goal have you given the system?
Yep.
And if you've given the system that people like the result, you can end up with something that's very, it's not truth seeking, right?
It's
It's
what?
inclined to, it's not seeking the truth.
Yeah.
It's seeking engagement, right? I think a lot of algorithmic news and social media feeds, give us a sense of where we might head with generative AI tools like Gemini and Grok and ChatGPT, that it gives you what will keep you moving towards whatever the goal that has set. Engagement, likes,
Yeah.
whatever behavior that the algorithm is set to optimize, which is not necessarily our happiness and sense of truth and beauty. And I think we need to just make sure that we're not only doing worthy use with these tools, but that we're just very clear-eyed about what we're trying to achieve and whether that is working.
That's such great advice, Dr. Gina, about setting an intention. What is the outcome that you're really looking for? And then really think about, is my AI agent the best one to help me with this? And maybe I do both. I work with my AI agent, and I also talk to my friend or my partner.
Yeah.
And it's interesting to me because I know I work with a lot of young people, and a lot of young people are saying to me, I mean, obviously I'm not a therapist, I'm an advisor, but they're saying to me, oh, I don't need my therapist anymore because my model knows me so well. In fact, my model knows me better than my therapist. And I'm trying to hold back saying, like, do you realize that your model is a frame, right? And anything outside that frame is not going to be contributed back to you, right? So if you're posing the prompts suggesting what you want to hear and trying to get confirmation of it. Whereas a therapist might have a divergent thought that's outside the frame, but is based on your welfare. You're never going to hear it because, as you say, the model is trying to accommodate your preferences and is essentially picking your word choice in your diction, right? That's what an LLM is. It's like, what's the next logical word, right? So it's like in your frame. So it's scary to me how we're maybe losing some of these social supports that brought in a larger frame or a widened aperture about our situation. And now we have sort of more confirmation of what we already thought.
Well, I think it's a amplification of what I would have called an echo chamber,
Yeah.
right? We can be in a polarized society and we gravitate towards people who have similar views to ours. And through a social process, we reinforce that way of thinking. But if you're in a one-person echo chamber, because your counterpart has no different life experience than you, it's just what you're feeding it,
Yeah.
then you can have all kinds of things go wrong, including getting more and more extreme, right? I mean, I think one of the reasons I worry about echo chambers and some of the ability to select yourself into an environment where you're not going to get contrasting views is that as a society, we lose the ability to articulate even what we believe. If I never am challenged on my views, I probably won't be able to share them in any fashion. Like, what if I were to come out of that bubble and somebody even just asked me in a non-confrontational way, like, why? I may not have done the work to defend my views that crystallizes them, that allows me to share them more sharply.
Yeah, exactly. Like, we're going back to Plato and the academy, the benefit of Socratic debate, right? Like, the way we really learn and sharpen our convictions is in exposure to other diverse ideas by people that have different lived experience, different knowledge sets, different expertise that can widen our thinking, challenge our thinking, and propel us to go back and check our own reasoning, right? And maybe, shift our position. So I do want to understand, like, what it's like to be a dean and, just on this trend. Like, I remember going to business school and my very first semester, I had a class that was called Strategy and Policy with Professor Lawrence Lavengood of Kellogg Graduate School of Management at Northwestern. And he changed my life because we would read these largely Harvard Business School cases, and then he wanted to have a discussion. And my maiden name is McKinnon, and he would always go, "Miss McKinnon, what do you think?" and put me on the spot. So I knew this was going to happen. So I really, really studied the cases, and I formed a point of view, and I listened to my peers, and I learned so much from my peers. I learned so much from him. But actually, that convinced me that I had an aptitude and, more importantly, a love of strategy, which led me to my career as a BCG consultant. And I have a lifelong passion for strategy that I never would have discovered had I not been in a class with my peers and a professor orchestrating a debate. So when you go into classrooms, I know you're designing this course, but I mean, are people still meeting in classes, like with backpacks and like discussing ideas?
So people definitely are. I will say that I have mostly taught online the last 8 years, I believe.
Okay.
So about half of the courses and programs at our school are online, which accommodates folks who have work commitments and I think it ties into the sense that learning isn't only in the classroom, but as people are working and going back and forth between that role and their role as a student in a class, that fosters great conversation. So in my own teaching, I really have tried to look at the perspectives in the audience as a key asset that we can all learn from and build on. So making sure that not only am I sharing out to the students that are in my class, but that I'm also challenging them to like find information that you can bring to us so that we increase the breadth well beyond what I can share in my own frame. In terms of what being a dean is like
Yeah.
at this time, so I started that in 2024 in May, and it has certainly kept me on my toes. So, as we started, I really appreciate being able to approach my work with a sense of curiosity and having a chance to learn. And one of the things when I was stepping forward after talking to you about stepping forward as a candidate for the deanship from initially being interim, I talked to a colleague who said, what you need to decide is what succeeding in this looks like, because it can't be pleasing everybody. It can't be doing all the things you get asked to do, because that's impossible. It has to be something else. And so I really decided that learning in this role about myself, about the school and university I'm a part of, about the field and where we're headed as a society and how we support learning and knowledge generation, that's what I've held close to in a time with a lot of tumult, a lot of need to pivot. But it's absolutely been an amazing learning experience. So on all those fronts, from noticing how I show up and realizing that my own sort of buoyant optimism carries forward even into times with a lot of challenge, I realize that is not very context dependent. It's really ingrained in who I am and how I show up, and that has allowed me to keep looking for what I can learn, where I can shape our path, getting a bit of distance from some of the challenges that we face, to really think about, what are my options and how do I choose and who needs to be at the table to help with those conversations. I learned a lot about my own shortcomings and limitations, things that can get in the way, how I can try to avoid missteps and blind spots, which is mostly leaning more into my team, which I continue to look forward to doing in the new year.
Yeah.
So I think those have really been very interesting aspects of it. It's also a pretty different field. Like I was not trained in how to run an organization. So it's been a lot of learning on the fly, a lot of seeking counsel, looking up terms after the provost uses them in a session with me, because even some of the more basic business terms, they're just out of my vocabulary.
Yeah. Thanks for keeping it real with us, because we probably have a lot of people in the audience that aspire one day to be dean. And you're, I think, if not the youngest, one of the youngest deans of a school of public health, or just a dean at a university in the United States. You went right through in a power move from UCLA undergrad Bachelor of Science to Masters of Public Health and PhD, boom, 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 in epidemiology with Washington University. And here you are. You've published like a gazillion articles, more like 105, 110, I don't know. You have an amazing book. But what I appreciate so much about you is, I never could quite put my finger on it, but you just did, buoyant optimism. I think this buoyant optimism is very contagious, and it's such a beautiful capability to share as a leader. And I'm sure that everyone at Drexel treasures that. So talk to us a little bit
Thank
about...
you. And I do want to just say, I think that it's sourced in really believing in the good of people,
Yeah.
right? I think that we're going to be able to get through the challenges that we have because I think we all want to craft a story where we are seeking truth and beauty and the good of others, right? I think we get lost from our course, but we want to be better versions of ourselves. And I think that allows us to keep coming back together and keep moving forward.
That allows us to keep coming back together and keep moving forward. Well said. I know I was debating whether to ask you a lot about the state of public health in the United States. And I think I kind of like this better is really your counsel to us all to play the long game and look for the light and look for the ways to contribute. And when you were describing your approach of learning how to lead an organization, which is a little bit different than what your training was, that you surrounded yourself with a panel of experts advising you, and you thought about who needs to be at the table. And I think that's really why encapsulates why you're such a powerful, impactful leader, and why we wanted you on the Impact Pod is because you're always thinking about who should be at the table. So for young people out there, you also have a fantastic husband, a wonderful daughter, fantastic family.
We're celebrating 20 years married tomorrow.
You are? Yay. What are you going to do?
We're going to Hawaii.
You're going tomorrow?
No, we're going the next week when the university closes for the holiday.
Yeah. Okay, that's beautiful. Congratulations. 2 decades. It's beautiful. I've met said husband, and he's a lovely, fascinating person, and said daughter is wonderful and skilled at many things. So what advice do you have for people trying to think about having a challenging job like being a dean, and also trying to be a parent and a spouse, and you also have a ton of really fun hobbies and friend groups. So like what advice, how do you think about trying to have a balanced life, Dr. Gina?
So I can't say that I have done it perfectly, but I have not done it alone. And so I think my first thought on it is realizing that you need other people to accomplish big things and to do it in a way that you feel good about. And some of real connection as you go through different life stages is asking for help. You know, we've had tremendous support from the parents that have been a part of our life in helping us raise a now 15-year-old amazing daughter, friends that continue to keep me smiling and help me troubleshoot aspects of my day, hobbies that give me a chance to step away and feel like my whole identity isn't wrapped up in the latest work crisis.
Yeah.
You know, I think those are just what I have noticed I need to be successful. And I don't mean successful in some performative, what other people think I should do. I mean to be successful on my own terms, which is to be at the ready to continue to learn.
Yeah.
And I try to notice that my own energy, my own sense of optimism is really required for me to do my work as a dean, as a researcher, to show up as a parent the way I would like, as a spouse, as a friend, as a sister and daughter. You know, all these roles are really important to me. I think something that, you know, I don't think any of us find a perfect path through. Something that's harder for me is doing things that are just for me. So protecting my own boundaries and needs is sometimes difficult, but I have realized that I am all about upholding my commitments to other people, and I can use that to protect my own health and well-being. Something like playing bridge, one of my hobbies, it is a commitment to my bridge partner, my bridge group, to show up and be fully present. That is easier for me to hold than other ways that I might try to protect leisure time for myself.
I love that. I love how you talked about having an optimistic outlook actually infuses everything that you do and who you are. And it helps you to be of service to others because you show up with the glass is half full, let's roll up our sleeves and figure out how to make things better attitude.
And as with almost every strength, there's a downside to that. And I think some of the work that you and I had done together, you know, I don't like facing that I can't do everything.
Yeah.
I don't like to admit that. I don't like to see that I'm overextended. So I resist things like a full inventory of commitments because I'd rather just do the next thing. I think I can do that well and get it done. And so figuring out, where are my own sources of resistance? Like where can I just make gentle, kind observations of myself that help me get out of my own way.
Yeah.
That's been really important to going along.
Yeah. If we can't be gentle and kind to ourselves, then it impacts our ability to be gentle and kind with others. So it's very wise. I have two last questions for you. I'm going to feed them to you. I'm going to ask them of you one at a time. So the first one is, let's say you're talking to somebody that's interested in basic science research, the academy, maybe they're leaning towards epidemiology. What would you say to them about what have you found rewarding from that study?
So I think there's two questions. What do I like about it? And then how to decide what is a good fit for an individual, right? So what I like is that I get to work with amazing people, figure out questions in ways that feel challenging, setting me up for growth, bringing me into new topics that I'm curious about and that I think can have a real impact. So that sense of progress, of not getting to done, but getting to better, getting to more relevant, getting to more connected. I love that about higher ed and about science and about epidemiology in particular. I think I would say I had dabbled in other things, lab sciences, field biology. I like that I am, not seasick on a boat somewhere, and I don't have to think about breathing on the samples on the lab bench in front of me. So it plays to my preference to be, careful. I don't mind doing hard work. In fact, my favorite projects that I've done have been really intense in terms of cognitive load of diving in. But I'm not in a physically challenging situation as a epidemiologist who studies how neighborhoods affect health. I'm usually working with digital data and images, which can be really interesting, and teams that are really great. The other piece of your question about how to decide, how somebody should decide what to do, I always think that diving in to some aspects of what you think that person would do if it's your future self, to figure out if it's a fit, that's the best way to get to clarity, and defining that as a win if you can scratch something off your list. So trying something out and realizing that, hey, I don't want to be on boats all day because I get seasick. I don't want to be in a lab because I feel klutzy. I don't want to be in an environment where I don't have any mentorship to continue developing. Those rule outs were really useful for me along the way. So generally what I have been able to continue doing are things that I did often and well, and that opened up possibilities to do more. So just learning by doing feels like the most clarifying way that I've charted a path. And I think it's true of getting involved in some of the administration and leadership roles that led to being dean, the directions that I was interested in reading about as a scientist and in building my research direction and program, in recognizing about myself that I loved the interdisciplinary collaborations and the challenge of translating across fields, of working with different groups that I couldn't understand at first. Like, I just was able to see that that matters a lot for me. And I don't think I would have known it without just rolling up my sleeves to do some of it.
Great advice. Great advice. Okay, my last question is, Dr. Gina, what gives you hope?
What gives me hope? So I think, what gives me the most hope is that we don't come from a past that's perfect. We have all kinds of things that we've overcome as a society, as individuals. And I think that suggests that we can continue to move forward. We can continue to have choice about who we want to be individually and collectively. And we can learn along the way. And I think that sense of just, we're not stuck. I think we're in a time where, certainly in higher education and public health, there's a lot of worry of disruption and loss, realized loss, fear of future loss. But if we can step back and see, holding to status quo, being stuck, never being able to change things would be worse. Then I think we can find hope in that possibilities are open. And we don't have to have a perfect, smooth path for that to be a good future. It can be a future that we learn from, and a future that we, try directions, reset, and get back on the path that expresses who we are and what we care about.
Yeah, I love that. Let's shape the future that we want, and let's take an active role and have our voice be heard. So I want to thank you so much. I've admired you for so many years, and friendship has enriched my life. I'm such a fan of your work. You're such a heart-centered leader, and your intention is always to be of service, to invite others to learning, to invite others to be heard, to make sure we have diverse seats at the table. And you're a very accomplished, amazing leader. So thank you so much for being with us today.
Well, thank you so much. You've been part of my journey and my friendship circle, and I really appreciate the chance to continue the conversation.
Thank you.